Zimbabwe is the latest country to announce that it will impose a nationwide lockdown for 21 days from Monday to help curb the spread of coronavirus. Several countries in Africa and around the world, including South Africa, have imposed lockdowns to combat the spread of COVID-19. I'm now joined by Dewa Mavhinga. He is the Southern Africa Director with the Africa Division at Human Rights Watch. A very good evening to you, Mr. Mavhinga. Thank you so much for joining us. Welcome to the Globe.
Thank you. Good evening, Superior, and good evening to the viewers and listeners.
These lockdowns, I want us to discuss the efficacy with regards to national lockdowns. Just how effective are they?
Well, the idea of national lockdowns is to try and control and limit the spread of a virus. And so it can only be effective to the extent that you address the social and economic context of the people. So, for example, if you look at the people in South Africa in the townships or in the townships in Zimbabwe, how do you educate them and ensure that the vulnerable groups have access to basic necessities, to food, and they can continue to survive, because the informal sector, the informal economy is huge, and these people need to be supported. So it's not just a lockdown, but it must be supported through mechanisms to provide food to the vulnerable, and also information to teach the people so that they can take the leadership themselves. The army and the police are certainly not enough to enforce a lockdown. It has also to come from the communities themselves to realize the importance of a lockdown in order to prevent the spread of this pandemic that we are facing now, COVID-19.
I guess the complexity now is that in as much as lives need to be saved, what if the end does not justify the means? And I suppose it will certainly be a tough balancing act between saving lives and, of course, not infringing upon people's rights to liberty and movement and association.
Absolutely, and as Human Rights Watch, what we are saying is that lockdowns should be implemented in a rights-respecting manner, and it is important, as President Ramaphosa said, that those deployed, the army and the police, should be out there, but with respect, because you need to have the communities on side, and these lockdowns should be reviewed constantly to find out whether or not they are being effective and what the gaps are. So it's not a hard and fast rule, it's not cast in stone. What is important is to be aware of the rights of the people, but also of the emerging public health crisis that needs to be addressed.
Now, we've seen Zimbabwean doctors and nurses just a couple of days ago saying that they intend on withdrawing their services because their pleas have not been addressed by the government. They're pleas that they need to get the PPEs, like personal protective equipment and gear, and those pleas have not been addressed by the government. So then I guess it triggers a debate, a very fierce debate between two narratives: A, that their lives matter, their lives are very important, and no matter what kind of support that the government may be rendering to the nurses and the doctors, once they lose their lives, the government cannot replace their lives. And B, well, some may look at this action as opportunistic, because they're saying that they are using this crisis to further their own ends.
Well, I think we need to acknowledge that the Zimbabwe health sector has been fragile for some time, and the crisis that is there now, the pandemic, has exposed those fault lines. And yes, as the UN and the World Health Organization has said, health workers should be protected because they are the first line of defense. And in the case of Zimbabwe, it's very important now that the government there acknowledges the shortcomings and opens up to the international community to step in urgently to resolve this crisis, because it would be unfair to expect health workers to put themselves on the line without looking at the need for them to be safe and to be protected first. And in fact, this crisis came to light when Zimbabwe recorded its first death from someone who had tested positive to coronavirus. And the way in which the hospital was run exposed the sad reality that the government and the authorities are not prepared and the health workers are exposed in a huge way, and it should not be like that. To fight this pandemic, the health workers must be protected and confident, and the authorities must supply the needed equipment.
And we know that the South African government has made interventions to accommodate those who are homeless. What about those countries and communities then who have, certainly in a way overlooked those homeless people? Does that not infringe on their right to be protected from this crisis?
Well, it's a clear infringement on the rights of the vulnerable groups, the homeless communities and groups in jails. And what is important to note is that a country is only as strong as its weakest link in the community. So for as long as the homeless people are not supported, it means that they are exposed, they are vulnerable, and then it means that it will be difficult to contain and control the pandemic. So it is important for the governments to reach out to the international community and to other supporters to ensure that there is no community that is left behind, because that group that is left behind will become the source of the problem for the entire nation.
And for those that have been accommodated, I'm referring to the homeless people that have been accommodated at accommodation shelters in different parts of the country. What if the 21-day lockdown period lapses? What then happens? Because I would imagine it will be very difficult for the government to throw them back onto the streets.
Absolutely, and in terms of good health support mechanisms, it means that it should go beyond the 21-day period. In fact, the governments should now be thinking of a sustainable way going forward beyond this temporary period of continuous support, and also of ensuring that communities have enough accurate information about what needs to be done to protect themselves and others, so that you do not have, because indeed there could be cycles of this virus, it could come back again in the future. So there is need for mechanisms and infrastructure that is supportive to protect communities going forward.
And Mr. Mavhinga, you're now raising a very important issue, that of the post-lockdown. What happens after that? And, I know that some governments may not necessarily have a plan in place to deal with the situation post the lockdown. So if not, is that in any way an infringement on people's rights?
Well, ultimately, it could be an infringement, but the good thing is that the international community has rallied together. Look, this is a global pandemic that is affecting everyone everywhere, and the lockdowns are not only across Africa, but also in Europe, in the UK, in the US. So what we now need is for the authorities to reach out and connect through the World Health Organization to ensure that there is a continuous learning process and sharing of information and best practices in terms of healthy conditions, healthy living, and in terms of responses that have proven to be the best to dealing with this pandemic.
Dewa Mavhinga, the Southern Africa Director with the Africa Division at Human Rights Watch, thank you so much for joining us.
Thanks.